Hello everyone, welcome to this lecture. Dynamics of disease transmission. So other name for this, chain of infection or medical model of infectious disease. So there are three chains. One is source or reservoir, mode of transmission, and susceptible host. So the infection is transmitted from the source or the reservoir to the susceptible host through multiple modes of transmission. So we'll study one by one. First, reservoir. Reservoir can be an human or an animal or an arthropod or plants or soil or substance, an object from which an infectious disease lives and multiplies, on which it primarily depends on its survival, on which it reproduces itself such a manner that it can be transmitted to the susceptible host. Source can be an animal or a human or can be a substance or an object from which an infectious agent passes to or disseminates to the susceptible host. So the idea is, take this as a jar of water. So we are going to use a cup to draw water from this big jar using this cup, and the human who is going to consume the water is the host. So the big jar is the reservoir, this one is the source. The infectious agent will be living and multiplying here. This is just for transmission. We are going to use the source. Now we have animal reservoir, non-living reservoir, or human reservoirs. Human reservoirs can be case or carriers. Cases having the symptoms, signs and symptom of the disease. Carriers won't be having the signs and symptom of the disease. So we have primary case. The first case introduced in the community is primary case. Whoever developed disease from the primary case is secondary case. Whoever comes to the attention of the investigator first, or a doctor, whoever comes to the doctor first, that can be index case. And in other way, we can say cases as classify cases as clinical case, subclinical, or latent case. Signs and symptoms. Second one is presence of organism in body fluids. Third one is shedding of the organism. If it is a clinical case, these three will be positive. If it is a subclinical case, signs and symptoms will be negative, but presence of the organism in the body fluid and shedding of the infection will be positive. Latent case, signs won't be there, all will be negative. Disease organism will be in a dormant stage. Example, herpes simplex, varicella zoster. And carriers. So first of all, carriers are developed from the cases. It is going to spread the infection, but the signs and symptoms won't be there. So convalescent carrier, during recovery it is going to spread infection. Incubatory carrier, during the incubation period it is going to transmit the infection. So healthy carriers are the one developed from the subclinical cases. They never had the overt disease. Examples are given for convalescent, incubatory measles, healthy carriers hepatitis A. And then another classification, temporary carrier or chronic carrier. So for some period or long period. Typhoid, example for chronic carrier. And portal of exit, they can be divided into urinary carrier, respiratory, or intestinal, other type. Now comes mode of transmission. There are two modes of transmission, direct and indirect. In direct there are 5, and indirect also there are 5. Direct transmission, direct contact, it can be skin to skin contact and mucosa to mucosa contact or skin to mucosa contact. So for example, sexually transmitted diseases and leprosy and skin and eye infections. Now droplet infection. Droplets are saliva and nasopharyngeal secretions. Less than 5 millimeter size of droplets will directly reach the alveoli. So example is TB, soil contact. Example, tetanus and some fungal infection. So inoculation into skin or mucosa. Example, rabies or needle prick and hepatitis B. Transplacental, all the torch infections can be transmitted through from the mother to baby. Now indirect transmission, again 5. Vehicle borne disease through water or food or blood, organs, tissue. So example, hepatitis A, water. And vector borne through arthropods or other living carriers. Mechanical and biological is there. Mechanical through feet, proboscis or fecal material. And biological, the infectious agent will enter into the agent, lives and multiply. If propagation means only multiply, cyclopropagative, multiply plus development also. Cyclodevelopmental, only development. Example for propagative, plague bacilli in rat flea. Cyclopropagative, malaria parasite in mosquito. Cyclodevelopmental, microfilaria in mosquito. So airborne through droplet nuclei. Sizes around 1 to 10 micron. These are the remnants of this droplets suspended in the air. Example, chicken pox can be transmitted this way in TB, COVID, other. And dust. So some of the big droplets are going to settle down in the ground and becomes the part of the dust, and when we sweep the floor, they will get activated. Till again come in contact with us. Streptococci is some fungal skin infections. And fomite borne are inanimate objects except food and water. Example, cloth, book, spoon and all. Unclean hands and fingers, typhoid again. So the next chain of transmission, we have susceptible host. So the susceptibility is depend upon the immune status of the host or nutritional, genetic or behavioral status of the host. What is successful parasitism? The infectious agent should find an portal of entry in the susceptible host and site of election. They should find a good place for multiplication, and then they should find a portal of exit to enter in the other organism, and they should be able to live in the environment for some time until they reach the other host. An incubation period starts with entry of organisms to the symptoms, that is called incubation period. Median incubation period means 50% of cases to occur after exposure. So latent period, for non-communicable disease we use this from the initiation to detection, after the contact with the risk factors and to the detection of the disease, called latent period. Incubation period can be short, medium or long. Shortest of 3 days, example diarrheal diseases. Medium can example mumps, measles. Long incubation period, weeks to months to years. Example leprosy, hepatitis, rabies and all. Now, what is the importance of incubation period? Using this period, we can identify the source or contact in that time, and we'll come to know that it is point source or propagative epidemic. In point source, all the cases will occur in the same incubation period. So some of the disease prognosis can be calculated by this. In rabies and in tetanus, short incubation period, the prognosis is very poor, and we can give immunoglobulins and antiserum in this period to prevent the disease. And we can plan quarantine mostly maximum incubation period time. And serial interval, onset of the symptoms of primary case to the onset of symptoms in the secondary case. That interval is serial interval. We can calculate incubation period using this serial interval. And generation time. So receipt of the infection to the maximum infectivity of the organism is called as generation time. What is communicable period? Period between the disease transfer from one person to the other person is communicable period. Now secondary attack rate. Number of exposed persons developing the disease within the incubation period is called as secondary attack rate. So number of exposed develop the disease, number of exposed, but within the incubation period. Multiplier is 100 here. Suppose disease is chronic, so we will be adding in the formula minus weeks of exposure or months of exposure or years of exposure. So the importance of secondary attack rate. We can find immune group and then susceptible group using that calculations, and attack rate in vaccinated people and unvaccinated people we can find, and then we can find spread of infection among family or a closed aggregates. That etiology is of communicable or non-communicable we can differentiate, and we can find out the effectiveness of immunization and effectiveness of quarantine. So we are at the end of our lecture. We have studied dynamics of disease transmission. There are 3 chains in that. One is source or reservoir. It can be animal reservoir, non-living reservoir, or human reservoir. Human reservoir can be cases or carriers. We have studied about mode of transmission, in that direct transmission and indirect transmission. And third one, susceptible host, under which we have studied successful parasitism, serial interval, incubation period, secondary attack rate. Hope all understood the lecture. Thank you for listening.